I'd like to invite the third-party opposition to speak with the minister. Mr. Ellis, did you want to combine your time? Go ahead.
Minister, who scheduled 6 hours for this?
We sure did.
Yeah, we'll talk to that later. I guess, Minister, more a question for your deputies than yourself, because I don't expect you to know it off the top of your head, but when we were talking earlier about the drug treatment courts, and you had mentioned that it was in corrections. Can you maybe give me an actual line item, maybe one of your deputies can, as to where the funding is for the drug treatment courts?
So apparently that is in line 8.4.
Okay, and would that be the all of it, or is that one specifically the federal funding and one the provincial funding?
As I understood it, the federal funding on that had ended, and it's now provincial funding that's provided for drug treatment courts.
For all of them now?
Yeah.
Okay.
If I'm incorrect, I will correct myself at some later juncture.
It's a big ministry. I don't expect to know the details on everything here. Thank you so much. So you said line 8.4, is that correct?
8.4, yeah.
Thank you. And I know you've touched a lot on the victims of crime, so I don't want to belabor that. But one thing that I did note is that department officials had told public accounts that identifying the needs of First Nations and Métis populations were among their priorities. Do you know what the status is of that work that's being done for those folks?
So as I understand it, gaps analysis has occurred on that work, and we will sort of move forward on that basis. I think there is probably still to come some additional sort of formal engagement, if you will, to ensure that all of those voices are being appropriately heard.
So with these communities, I think some of us touched on it already today, they're experiencing spikes in crime. Could there be an expectation that, or a willingness for them to obtain more funding?
Yeah, I think that that is what we are looking towards. It's certainly been, and I don't want to presuppose the outcome of the work that we're doing with the Auditor General, because obviously there will be some back and forth conversations there, but I think there are certainly early indications that victims groups are challenged in terms of their funding, and First Nations and Métis groups in particular. There can also be some challenges in rural areas generally, reasons being, that they don't necessarily have access to all of the same services. So one of the things that we will be examining is how to ensure that we're best addressing that so that everyone can get access to services.
Thank you. And if we can maybe go to talk a little bit about FOIP, and I do say this with the utmost respect. The Privacy Commissioner has been fairly critical of the Justice and Solicitor General's office specifically, and I'm sure you've taken actions. Maybe you can expand a little bit on what you're doing to ensure that FOIP requests are dealt with in a more timely way, and if so, is that reflected at all in your budget?
It is indeed. So some of the staff in terms of increased FTEs that you'll be seeing in this budget that's coming forward include an increase in FOIP officers from 10 to 18. So those backlogs had obviously been building over a long time, and we'd had significant staffing challenges in terms of turnover. So we've been working hard to make sure that we have the right folks in those positions, and that we are staffed up in a more general way to ensure that we're handling those, because ultimately really what we were looking at was just sort of an increase in volumes, and we've actually already started to see clearance rates improve, so we're starting to sort of get a handle on that backlog going forward. So our year-to-date is starting to look better. So we're increasing those clearance rates, and as we go forward and all those people come on stream, we'll see definitely faster processing, which I think is important to all Albertans.
Yeah, well, it's obviously an ongoing process. Thank you. If we can maybe go talk a little bit about the opioid crisis. Of course, police, as you know, are on the front line of this crisis, as well as a lot of our medical workers as well. But in regards to policing crime, of course, has spiked in Alberta. Is there a specific line item in your budget that reflects this opioid response, or is there something that is kind of throughout?
So in terms of response, obviously the primary response from the government is situated in health. And I think that for the most part, our policing partners would agree that that is sort of the appropriate approach to take on that one. It is my view that increased funding that we came through with for Alert will assist on the enforcement side, because obviously they do a very good job of that. You'll be aware of that intelligence sharing, and so that dovetails very nicely with the border service agencies, and in fact, they've had significant seizures going forward. So that's certainly a piece of what we're doing. And of course, in terms of the response, again, primarily on behalf of our partners in health, I think we have a support role in the sense of adding additional funding to the Office of the Chief Medical Examiner, so ensuring that we were able to bring on 2 additional medical examiners and a data person, I think will help us a lot in terms of getting better data. So we've changed the way we're reporting those deaths. We're doing sort of regular reporting in terms of fentanyl, and we're also looking to look at deaths that occurred from multiple drug toxicity to determine if we think that sort of an opioid was the main causal factor, because we think that data will help our health professionals determine how best to address it.
And you mentioned regular reporting, and I know Dr. Swan, of course, has been very vocal about this. What are we looking at, like quarterly, monthly?
So currently we're doing quarterly reporting out of the Office of the Chief Medical Examiner, and that, I think, allows us to make sure that we're using the best data possible. There is, of course, as there is in all things, a sort of way off between time and accuracy in terms of waiting for autopsies to be completed. I think it's really important for the public. They certainly want to know, and I think that is obviously their right. But I think it's very important that when we give them numbers, we are as confident as possible, or at least I would say reasonably confident that those numbers are correct. So of course, going through those files where you have a multiple drug toxicity and all the different tests that may be needed to determine sort of what is the primary causal factor, which again requires some significant medical expertise and is sometimes as much an art as a science, making sure that we get those numbers accurately so that we can be confident and proud in what we're saying. And you will notice that even the numbers we release, when we release them, there do tend to be little changes when it's determined that ultimately a cause of death was different than we thought it was.
So of course, I think we're in agreement here, having regular reporting is vitally important, especially when you are giving direction to your department in order to help solve this crisis that we're facing right now. And I do agree with you. This is a health issue, but as we know, we need to work together. You have a role in this as just like anyone else within the government and ourselves on this side as well. So with the regular reporting, hopefully that's going to be coming. Will this assist you in giving direction? I say direction loosely because I mean certainly I don't want you to affect any operation of a police service, but assisting you in giving a bit of guidance to Alert on how what they were going to be focusing their attention on. Maybe you can expand a bit on that.
Well, I think the information is probably very useful to those folks in determining where they focus their attention. alert is directed by a board, and it is often directed by input from the Alberta Association of Chiefs of Police. If we perceived there to be challenges,
I'd like to invite the third-party opposition, Mr. Ellis and the minister, to share their time or to speak. Would you like to share your time? Go ahead.
Thank you, Chair. Minister, one of our colleagues had mentioned something in regards to communications earlier, and it brought me to thinking back to a conversation I think we had about a year ago regarding concerns in regards to police infrastructure in the communications, which has been ongoing well before, of course, your government came to be. Is there any line items in regards to infrastructure for the communications issues that will certainly facing Calgary Police Service, but also in regards to other police services in Alberta?
sorry, just to clarify, when you say communications, do you mean like their radio?
Yeah, the radio, sorry. Yeah, the old Motorola radio, trying to get really deep in there.
Sorry, that was
sorry.
maybe a funny gesture.
No, yeah.
So,
You do.
in terms of line items, I do know that the AFRAX units, so the Alberta First Responders Radio Communication System units came on stream earlier this year. We had an unexpected test of those units within the Fort McMurray wildfires, and they actually performed very, very well. And we were very proud to be able to have so many multiple fire responders all on the same system so they could communicate at the same time. So services will sort of transition onto that at their own pace. Our employees have transitioned over already primarily, I think. Our CMP from various jurisdictions are transitioning on. As I understand it, Calgary has not made the final decision as to whether they will transition on. We will make that available to them if they are ultimately interested in making that decision. If they do, they will probably transition on considerably later.
Yeah, so my memory as well is that Calgary was the last or has not made a commitment to this. Aside from Calgary, though, have all the other police jurisdictions in Alberta made some form of commitment into this new radio system?
I certainly understand it's the majority. The RCMP definitely, so they obviously represent the majority of our policing jurisdictions. Other than that, I'm not at this moment totally sure if everyone has signed contracts. So we'll have to report back to you with that.
But to your point, the infrastructure's in place. We'll call it the resources available for police services to sign up to it if it does meet their needs. Is that correct?
Yes, so it is, we do have the infrastructure available for everyone to join in if they're interested. And sorry, I'm actually going to jump in because I have now remembered that I meant to correct myself earlier. So when I said that we didn't get federal funding for drug treatment courts any longer, that is incorrect. We in fact get $500,000 a year from the federal government, and that is what goes to support those programs.
Okay. And staying on that line of a thought process there as we get away from the communication side and go back to that, would any of that money that the Alberta government was able to receive from the federal government, is any of that going to your department for any of the initiatives for drug?
So, sorry, which money?
I think your government was able to receive about $7 million from the federal government for, and BC had received $10 million. For
With respect to fentanyl,
Yeah.
my understanding is that will be situated in health, so it will flow through health funding. If I'm wrong about that, I'll let you know.
Oh, okay, yeah. Okay, so continue on the train of thought regards to the opioid crisis, and we had touched on it earlier regarding Alert. Has Alert requested any more funding to address the opioid emergency and certainly the pressures that they're facing right now from the public?
At this point, no. We remain hopeful that our ongoing discussions with the federal government on that gangs and guns funding may yield some fruit. But at this point, I think we're looking to ensure that they're able to maintain the functions that they currently perform. And for the most part, most of our services are quite happy with what they are receiving through that. But I think, like all resources, that will sort of be an ongoing thing to watch. But obviously, I wish we had taken government in a time when there were lots and lots of oil revenues, but...
Yeah, I wasn't either. Police, referring to all the police services in Alberta, have any of them specifically asked for assistance in dealing with the opioid emergency? Like if any of the other, so aside from Alert, but any of the other police services asked you?
So we do have sort of ongoing conversations when I visit with AACP about this issue. Usually we're the ones who set that on the agenda to have those ongoing conversations, but I think it's important to all of them as well. Certainly we have been approached by a number of services indicating that they're looking for sort of an alternative for people that has wraparound services, so essentially health support. Normally when we talk to them about that, it is about sort of replacement therapies and other treatments that are available for individuals, and ensuring that we're continuing to flow funding to health and ensuring that health has those options available for people. So generally those conversations, center around ensuring availability of treatment and ensuring that we're continuing to provide other sort of housing and other supports to people so that they are able to deal with their struggles with substance use as they move forward. Again, a lot of the requests sort of center around ensuring that we have wraparound services. So in sort of the ongoing conversations we've been having about supervised consumptions, they have a really strong interest in ensuring that it doesn't look like it does in Vancouver, which is to say it isn't just a place where someone goes to inject drugs and then that's the end of the story. They are really, really focused on making sure that those people who are accessing those services can also choose to access other treatment options, and they also have mental health supports available, and that is the model that we're working on with community groups now.
Thank you. In regards to, I know we'd had discussions regarding naloxone kits being available to first responders. So specifically in your department would obviously be police and peace officers. Are you providing the police services the naloxone kits, whether it be the nasal or the needles? And if so, is it reflected at all in your budget?
So again, that will come through Alberta Health Services. They do provide free access to injectable naloxone, or they provide the nasal, but I believe there's a cost associated with that because it's a little bit more expensive than the injectable form.
So if I was a police service in Alberta, I would have to contact the health department in order to receive the naloxone? As
I understand it, that procurement occurs through health. So if you're wanting injectable naloxone, I think that you can get it directly through Alberta Health Services, but with respect to the nasal, it would be purchased, and I'm not sure whether that's through Alberta Health or elsewhere.
And do we know if we have enough to meet the demand at this time?
So we have significantly increased the availability of those kits. So they are, the first responders have access to as many of them as they want. In addition, they're situated in a number of different community groups, and any private individual can get access to that without a prescription. So we have sort of a massive increase in the number of those kits.
And I'm assuming, and please correct me if I'm wrong, if you have them readily available in your corrections facilities as well.
They are readily available in the correction facilities as well.
Are the corrections officers trained in a way to use them?
They are trained to be able to administer naloxone in the case of an emergency. Obviously, after that initial response, we would want a health professional coming in to deal with that individual, but they are trained to do the initial emergency response.
Thank you.
Thank you. So I would like to invite members of, or Mr. Ellis from the third-party opposition and the minister to speak. Would you like to combine your time? Thank you.
That's all we got left. One of the things that I was thinking there, you were speaking, Minister, you had spoke with the new deputy commissioner, is that correct?
Yes, that's correct.
And this is absolutely meant as no disrespect to the RCMP, but certainly this is just something that sadly they're an organization that has always been stressed for resources like anywhere else in the country, and they of course with our municipalities utilizing their services, especially the smaller ones and the ones that are under 5,000, the RCMP sadly at times has a tendency to overpromise and underdeliver. So what I guess I'm asking you is what conversations have you had with, if any, in regard in our new deputy commissioner, just to ensure that the human resources that have been allocated to jurisdictions are being maintained. As an example, if a certain detachment has, and I throw this hypothetically, a sergeant, X number of constables, that they're not really getting a corporal and 2 constables, right? That they're actually getting what they are paying for. I don't know if you have any influence over that, but have you had any discussions in regards to that?
So generally, deployment decisions are made by the RCMP, so they do that sort of deployment work. I do know, if what you're referencing is, I do know they've had challenges recruiting to some rural jurisdictions in Alberta, and sometimes positions will go unfilled for a while. Certainly that wasn't in my initial discussion with the new deputy commissioner, but we had ongoing discussions with the previous deputy commissioner on this issue and on ensuring that we are able to get timely access to those resources. I know they do consider, internally they consider sort of incentives to ensure that people are willing to take those positions and they're willing to move around. So certainly they do work very hard on that, but I think, we'll continue working with them going forward, and we do sometimes hear from municipalities about concerns about positions that have been vacant for a while that they've had challenges recruiting to, but I think those are challenges in terms of rural recruitment that are experienced in a number of fields, so with respect to doctors as well.
Yeah, no, I agree, and it's I'm not trying to be adversarial at all. Actually, I just, we have smaller communities that are, we'll say, almost some of them taking, which I would never support as a vigilante approach to some of the crime in the area, and then we as Albertans have a certain amount of resources that have been assigned and paid for. I guess I would encourage you to have those conversations with Deputy Commissioner. That certainly would save the people of those rural communities from having to pay for an officer that really they've already paid for, if that makes any sense.
No, I absolutely agree with you, and I think we will work with them going forward on ensuring that's the case. I think you're referring to some incidents in Saskatchewan that they've had challenges in terms of rural policing and some vigilantism, and we certainly do not want to see that come here to Alberta. So yes, we will definitely work with them very closely to ensure that they are maintaining those resources, and we will continue to work with our municipal partners on what they need in order to fulfill that.
Great, thank you. Minister, I think you would concur with me that, you know, the Law Enforcement Review Board is you know, one of those agencies that assist in maintaining public trust. So as we look at page 189 of the Law Enforcement Review Board, it increased public funding has decreased. Can you maybe explain why the funding has decreased for the Law Enforcement Review Board?
Sorry, it was here somewhere. I am seeing that, so it's about $7,000. So 0.2 million. It's primarily due to lower than budgeted honoraria payments as a result of fewer than anticipated board meetings in 2015-16.
Oh, okay. In fewer than anticipated board meetings is, I guess, as an ex-police officer, that's a good thing. But are the police services, to your knowledge, being able to resolve their citizen complaints, I guess, before they reach the LERB? Is that really what that boils down to?
So some of that, I mean, there was, I think, a small, we probably didn't quite project the right number of meetings, but it's comparatively small differential. You know, in some cases that will be through being able to resolve those matters internally, and they do have their own processes generally for resolving that matter, and that does, the number of hearings tends to vary from police service to police service and jurisdiction to jurisdiction, but the board will do as much work as it's provided, so I would assume that some of that at least is from police services being able to resolve those things themselves.
Thank you. Minister, if I can ask you a question just in regards to photo radar. And please, forgive me, I'm not familiar with the formula, if there is a formula in regards to that. But obviously, when you receive money from the tickets, how is it distributed to municipalities? So whether it be Calgary or a smaller jurisdiction throughout Alberta, is there a formula for that?
So for jurisdictions where they pay for their own policing, we keep, the money flows into the province. 26.67% of that money is retained and the remainder is flowed through to the municipality.
Okay, so all municipalities. So, and then in regards to, so I'd like to take Calgary and Edmonton out of the picture here, but when we talk about photo radar in some of the smaller jurisdictions, which, please forgive me here, would be a peace officer of some kind, is there any direction that comes from your office in regards to photo radar, or is that strictly at the purview of the municipality that has hired that officer?
So my office is involved in terms of approval of the devices. It's also involved in terms of, we hear from police services, so they have to file, when they have a photo radar location, they sort of have to file information about why that's necessary and why it increases public safety. And the police service of jurisdiction, so whatever jurisdiction it is, obviously primarily the RCMP, will sign off on sort of what that plan is. In some cases, it will be administered by the police themselves. In other cases, municipalities have taken that into their own hands. And then that plan is filed for approval, and it has to meet certain guidelines that are set out by the ministry.
So has your office approved the or does it have to be approved? The drone photo radar, which I've heard about recently, or drone type of monitoring?
So I would guess that that would be a new technology.
Yeah.
I'm not
read about it in
aware
an
that
article.
has yet come forward. We haven't yet seen an application for that drone technology.
Okay, but so, just to be clear, before, even if a police service was, we'll say, experimenting with the technology, before they could actually utilize it, it would have to be approved through your office before an actual ticket can be generated, I guess.
So I don't want to stray too far into giving an interpretation of the definition, but I would suspect that a drone would be a new technology and it would need approval.
Thank you.
I'd like to invite the third-party opposition member and the minister to speak. Mr. Ellis, would you like to combine your time?
Thank you.
Go ahead.
Thank you, Chair. Minister, we were chatting in regards to the opioid crisis and police services, and that they haven't specifically asked you for assistance, but as we know, crime has increased in municipalities and of course rural areas as well. And one of the concerns that I have heard, especially in regards to rural communities, is that whether it's directly related to fentanyl or not, it's certainly to be debated, but certainly there's an increase and a spike in crime, and they have been asking, as far as the smaller municipalities, been asking for assistance. And is there any mechanisms, any funding, anything that your department is doing to assist them with the spike in rural crime?
So there's a couple of different mechanisms available. So obviously, with respect to most of those rural municipalities and the small urban, so under 5,000, the province pays for policing. But if they feel that additional policing is necessary, there's a mechanism by which they can contract for additional officers, those municipalities. So those tools are absolutely available to them if they feel that they need them. In addition, the ministry provides grants in terms of civil forfeiture, which can go towards victims programs, but also towards crime prevention programs. And so a number of programs dealing with rural crime are funded through that mechanism as well.
But the levers, I guess, or the lever for those municipalities to get an extra officer or two. And believe me, I'm no expert on municipal laws or anything like that, but I mean, I guess really it's about going to their constituents and asking to raise a tax of some kind, I'm assuming. Is that, unless there's anything that's offered?
Well, or, I mean, as with most governments, they would have the option of either increasing revenues or sort of decreasing expenditures in another area in order to, I mean, governments the world over sort of signal their priorities through where they're willing to spend their funds. So I think it wouldn't necessarily require a revenue increase. It could, have a decrease in expenditure elsewhere in order to sort of cover the cost of that.
Okay, thank you. So if we can look at the performance indicators on page 102 of the business plan, property crime and nonviolent crime severity index took a very shocking increase, spike, 2015 in Alberta. In fact, Canada's index number was 68 in 2015, and Alberta's was a 104. Now it's widely believed that the opioid crisis, the fentanyl crisis, was a major contributor to that. Is that what your intelligence, the data that you've collected, is telling you as well?
I think it's difficult to pin it down directly. Certainly, the opioid crisis is a factor in that. As I understand it, what we're hearing from our police partners is that they think in some areas that there may be some other drugs, some other increase in drug use, so meth, for instance, that may be also responsible for some of that. There is generally a tendency for crime rates to co-vary to a certain degree with inversely, I suppose, to economic outcomes. So when the economy turns down, there is sometimes an increase in crime. The mechanisms for that are obviously complex. I don't want to suggest that, there's a direct link in that way. But certainly there is that sort of covariance that's generally observed. So there's a couple of different factors, I think, at work there in terms of that increase, but I think it is a concern and something I think that's a concern to all Albertans and that we'll continue to monitor very closely.
So that's great. If the spike continues to increase in, I think it increased in 2016. I don't have the number in front of me, but if it increases again in 2017, do you have some strategies in place to deal with this?
Well, certainly, in terms of dealing with crime prevention, I think it's done on a number of different fronts. So certainly we will continue to provide funding to municipalities. In Alberta, sort of relative to other jurisdictions, the province pays quite a larger share of the policing costs than is the case in other places. And despite significant drops in revenue, we have managed to maintain that. And I think that that's something we can all be proud of in that way. In terms of moving forward, I think a lot of it really has to do with ensuring that we're continuing to support the services that Albertans rely on. So ensuring that people who do find themselves in a situation where through no fault of their own they have lost their job, that those people can access benefits, ensuring that families who are sort of on the edge have access to things like the child tax benefit. Those things are definitely pieces that will help that in the long term as we anticipate sort of seeing some return to prosperity.
So you touched on prevention, and of course on page 101, the key strategy 2.1, it points to a preventive approach to criminal justice. Maybe you can expand on that a little bit in regards to further initiatives that your department is taking as it relates to key strategy 2.1.
Certainly. So a large part of that will rest in other ministries or with our policing partners. But certainly we, one of the things that the department provides is civil forfeiture grants, which can go directly to crime prevention initiatives. A lot of those crime prevention initiatives will be initiated on behalf of police services, and obviously, with the RCMP we fund directly, and with other police services we provide support for those. But a lot of crime prevention, particularly when we're seeing that link potentially to substance use, I think a lot of that has to do with ensuring that those folks have access to treatment programs when that becomes necessary. Ensuring, again, these increases will be reflected in other budgets, so ensuring, access to treatment, and a lot of money has gone into that, ensuring access to mental health support, and a fair amount has gone into that as well. Increasing the stock of affordable housing and supportive housing spots. All of those things, I think, overall, and certainly in my conversations with our policing partners, they have said that a lot of those mechanisms are really necessary. And they have two benefits, right? So it's not just a benefit in terms of lifting families out of poverty to help support children so they ultimately don't wind up in a gang lifestyle. They also have the impact of making sure that police can spend less of their time on sort of social disorder problems and spend more of their time focusing on crime. You'll probably be more familiar than most people around this table with the fact that ultimately when other services fail, when health services fail, all of that burden falls on the police to deal with that. So ensuring ensuring that we're providing that consistent support to those ministries, I think helps a lot with that.
Are you providing guidance to the police services, or is there a working group or a structure in place in regard to prevention?
Certainly it's something that is discussed sort of around the table at AACP a lot. They do have a number of working groups right away. I don't know if any of them are specifically targeted to that, but we can certainly look at that going forward. I've had the opportunity as well to meet with the new Deputy Commissioner for the RCMP, and he has actually a lot of ideas that we've already been discussing in terms of those sorts of initiatives, so I'm sure that we'll see more of that going forward as well.
I know you had mentioned earlier that you formed a working group in regards to the quote-unquote carding issue. Can you tell us, the status of that working group and what it's doing and what's accomplished and where it's at right now?
So that was just really to get input from different services in terms of how to handle the issue going forward and what they thought necessary steps were. I think
Thank you.